Pure and simple. Exercise doesn't solve a nutritional deficiency.
Doesn't get the oxygen into your body better, though, you're talking about?
Exercising,
Yeah, you're talking about oxygen. It's very important.
the blood oxygen level in everybody is fine. It's not going to vary much in the least. You talking aerobic exercise or anaerobic exercise? I mean, anaerobic is weights. Aerobic doesn't do much for what you think. The heart's already 100%. You're already beating your heart 100,000 times a day. Anybody here think 100,000 is not enough? If you don't, something's really wrong with you. So I've had people that say that. Exercise is fine if you want to release stress. You want to build more muscle. It's not going to make you healthier the way you think. There was a book done called The Exercise Myth, 1950, 60, by a cardiologist. And it was published by a major company. It's out of print now, of course. The biggest marathon runners had the worst hearts. It's not what you think. Yes. Nope. Is there an age limit when you should start? When the kid's in the womb with the mother. They're essential. It's not based on age. I mean, it's... Skin conditions. Remember I told you the skin is all omega-6? So these oils are phenomenal. Depending on the age, the older you are, the harder it is to reverse a skin condition because it gets locked in. Sometimes you can't reverse things, but makes a phenomenal difference. It's worth a try. Absolutely. Absolutely. One capsule per every 40 pounds for a kid, an infant. This is a food. It's essential. Back. Absolutely right. Biggest thing is high oxygen blood level means nothing. Everybody is above 96 unless you have some kind of disease. Means absolutely nothing. That's not the issue. The issue is how much oxygen is in the cell. That has nothing to do with what's in the blood, because from the blood it has to get into the cell. And there's about 7 points it has to cross. So if they're screwed up, it's not getting in. Very good. Cell membrane is how you fix it directly. The physiology has to be in there. The oxygen can go in two ways. It can diffuse in from the blood, or in the cell membrane, it can disassociate. There's physiologic pressure, so the oxygen can come out of that omega-6 oil and go into the cell there. There's two mechanisms. Everybody misses the second one. Very good question. There's no other way to do it. There is no other way. Anything else is delusional. Yeah, genetically modified stuff. Nobody's seen the long-term effects. I've read a pile of things. You give them to rats, they get tumors all over the place. This peanut allergy is probably heavily tied to it. If you want to be an experiment, take them. I don't touch them with a 10-foot pole. GMOs, I mean, they're just another thing, and most of the world won't touch them either. I think the UK won't touch it. Europe won't touch it. It's only in America we have companies like Monsanto with huge lobbyists get all this stuff through. The seeds they're doing, Roundup Ready seeds, are god-awful too. And they lie. They have less yield using this stuff than they did before. That is completely sinful. The farmers are going bankrupt because these guys, when they patented stuff, they don't breed. You got to buy new seed every year. It's insane. Don't touch them if you have a way around it. Tonight, I've had some people have success with it. Other than that, I don't know what you do with it. It's just something I don't come across too much. Has it helped at all, the oils? Or nothing?
I've been on it for 5 years, but tonight it's just started in the last few months.
What do the doctors say about that? Any idea at all? Yeah, I don't know if they have any. They never know where anything comes from. Anything else you've done differently over the past 6 months, or?
Well, I think it started with the virus.
Very well could.
Yeah.
Is it getting worse or staying the same, or?
It's changed. Just different things I've been trying, lose less allergies and stuff like that.
Hopefully it goes away. If it was a viral thing, it could go away.
Yeah, that's
Hopefully it does.
What kind of time frame would you expect type 2 diabetes to show something?
Type 2 diabetes you should be able to dump in 2 months by cutting back on the carbs, by taking the oils. It's simple as heck. Get 24-hour diet. I mean, this was written for diabetics. Type 2 is simple as heck. And do that protein powder fruit smoothie once a day. I'm telling you. Yep. Get organic ones. Strawberries are another crop that are awfully pesticided. Spend the money on organic. Protein drink or protein powder? What's the question? Protein powder. They have one out there that's an excellent whey protein. It's non-denatured, which means it's cold processed. So it's really good stuff. And a little goes a long way. All you need is one little scoop. Like a raw foods vegan, you can do it. PEO solution talks. The question is, you're raw foods vegan or something. Can you do this without supplements? The answer is yeah, like Rowan does, Dr. Rowan does. So PEO solution, I have my section, and right next to it, he has his. PEO solution, get it? Oh yeah, Dr. Rowan talks his own stuff. It's unedited by me. He can say whatever he wants, and some of the things are the exact opposite of what I say. But he's a clinician. I'm hardcore science, and he can say whatever he wants. Doesn't make it right, but he can say what he wants. And he also treats patients. So, some people say, it's too much, like on soy. I slam soy, and he doesn't think it's all that bad. I think it's food for a pig. But it's in there. He's a raw foods vegan. Oh, yeah, it's doable.
So if I didn't want to be a raw food vegan, though,
Well, you'd be close to it. You could be, half and half. I'm carnivore, so still get PEO solution. Because I come from a carnivore area, and he comes from a raw foods vegan. We're tied to the oils, but he'll talk about what he does. And what I do is take the best of both worlds. Like that protein powder fruit smoothie thing is a beautiful part for the raw foods vegan because I get the fruit just frozen. And it's raw by definition, it's not meat or cheese. You take nutritional yeast instead of whey. I don't know. I've never thought about that. Try it. It shouldn't hurt you. Bacon's okay. Saturated fat. Excuse me. Yeah, fat is not in an arterial clog. There's zero. Remember I told you that? There's no problem with it. Now, I like organic because you don't want the antibiotics. That's where all the problem is. It's in the animal residues. It's not because women are giving their kids too many antibiotics, and that's why everybody's antibiotic resistant. Now they have all these MRSA viruses and stuff in the hospitals. It's not because of that. It's in the darn food. They're giving it to the animals. Whether they're supposed to or not, they violate the law. They don't care. So I'm real big on organic meats, natural meats for that reason. No. The question is, will the oils help thyroid at all? No, because I did a test myself. Mine went kerplunk, and for years I wasn't taking anything, and the TSH was like 90. So they're saying, well, you're going to die, if you don't get in here. Well, what are the symptoms? Real overweight. I said, well, I'm not. Exhausted, not. So the oils compensate as much as it can, but my neck still got thicker. So now I take a compounded one, and it's no problem. But it's not as bad as they tell you. So if you just think, it's going to solve everything, it's not. And if you have any problems, a thyroid hormone's about the best one you can take. Don't take Synthroid, it's awful. Get a natural one like Armour or something. But it won't help it. But it maximizes everything else to try and compensate. That's what I did learn. Water-wise, I use RODI, which is reverse osmosis and deionization. Water is a mess. In Houston, it's sickening. Definitely you want something as close to distilled as you can. It's pretty cheap. RODI is equal to distilled or distilled, one of the two. Organic grass-fed butter is excellent. There's not a lot of PEOs in it because it's more monosaturated fat and saturated fat in butter, but I get grass-fed all the time and I eat a lot of butter. Hell of a lot of butter.
Vitamin O,
I don't know what vitamin O is.
especially treated water. I'm not sure what it's for.
Oh, it's an oxygenated one. I don't know. There's so much stuff there. Yeah, question is krill oil. Still a marine oil, it still stinks. It just stinks less. So there's less DHA and EPA in krill oil. But if you've ever seen a krill, it's what whales eat. It's this little thing a human doesn't eat. It's more nonsense made up. So you have fish oil because everybody was doing that. You need some gimmick. So it went to green mussel oil, and then it went to krill oil, and then it's salmon oil they have. Some idiot's got some squid oil. I think that's Sinatra. It's disgusting. It's all marine oil. You're not living in frigid water. You don't need the antifreeze. Parent oils, they're plant-based. So what I talk about in the book is that's the specs you want. Yeah, what's that called with nothing negative to it. If you want to swish coconut oil around your mouth. It's a very good antibiotic. It's very, very good. Well, it's inflammation. Dental problems leading to cancer. Anywhere where there's inflammation, it's a problem. So you better have something that's knocking down the inflammation. That's the bottom line. And the omega-6 oils go to PGE1, which is the body's biggest anti-inflammatory. You can look that up on your own. Nothing touches it. Where does black buildup come from? It's 85% screwed up omega-6. The adulterated oils, just what I told you about. That's it. When you do high-resolution chromatography, it's 85% screwed up oils, and it's not getting screwed up in the body. Cholesterol does not oxidize in the body. They got everybody conned with this. The problem is oxidized cholesterol. Remember I told you the cholesterol it's called esterified. It's magnetized to the oils. So when you measure oxidized cholesterol, are you measuring the cholesterol molecule itself? Are you measuring the screwed up PEOs by themselves? Or are you measuring the whole thing? You're measuring the whole thing together. And the bottom line is cholesterol does not oxidize easily at all. All of the problem is exogenous, which means you ate it. Not in the body. There's one antioxidant for every 160 lipid molecules. There's one antioxidant, so that means I've got to defend against every one of you out here. Now, I know a keto, you're still going to kill me. There's 160 of you. You're just going to trample me and I'm dead, okay, if you wanted to do it. If things went bad in the body, you'd need a hell of a lot more than one per 160. And this is known. I've never seen anybody quote it. It's in PEO solution. It doesn't go bad in the body. It goes bad when you ate it. You're eating it bad. This is what nobody gets. Multiple vitamins, I don't take any vitamins. I'm not big on them. Vitamins are still in the food. Minerals aren't in the soil, so they're not in the food. Big difference between vitamins and minerals, so I'm about biggest bang for the buck. Yeah. The kind of question is, how do you guarantee you're not getting too much where it's a waste? I'm really conservative. You may not think I am, but when it comes to this, I am. So I suggest an oil supplement of 3 grams a day, which is very little for a 160-pound person. You can take double all day long. But what I suggest people doing if they want to take extra, like if you're an athlete or if you have to work your tail off, either physically or mentally, take double and then cut back. See if there's a difference. You can always do your own test. Stop taking it and see how you feel. But at 3 grams a day, no way in hell are you taking too much. Good question. Good question.
What about aspirin, especially ACE1 for heart problems?
Yeah, good question. Aspirin for heart problem, awful. I have a whole report. If you look at my website, it's myname.com. Look under reports. I have a report called Aspirin is Awful. Read it and you'll answer your own question why. If you have any kind of cloggage and you take aspirin, it makes the cloggage worse. Aspirin would not be approved today if it started. And then they give all this garbage to take aspirin. It's awful. It's going to make your arteries clog up if you have any kind of clogging to start. So I don't care if it's an anti-inflammatory. It shouldn't be doing that. Could do much better. Aspirin is awful. It's just awful. The oils kill aspirin. Kill it. Yeah, ESSIAC. You can look that up on the internet, and it'll tell you what's in there. I'm not big on herbs by themselves because you can have herbs that can kill you, but these are non-stimulating, non-irritating in the amount. You can take a bottle of this stuff a day, and it's no problem. It's really an amazing, it's a phenomenal blood purifier, and with cancer, do not want metastasis. This really helps in that area too. It's excellent. Yeah, I've never taken digestive enzymes. Never taken probiotics either. You want to do it, you can do it. I've never done it. Butter, I like, as long as it's organic, I like the pasture one. I get one from France. I think it's called Lechon or something. No, it's not. I forget what it is. No, I don't know. Not regular Land O'Lakes butter. It's ruined. It's the same thing. It's going to be adulterated and not good. I don't trust it. I get either natural or organic on anything with fat. So bacon, eggs, butter, cheese, cream, get the organic. Anything else is way down the line. Even on the meats, if you cook it well done, you get rid of 97% of the problem. I ran tests on that years ago. Testosterogenic is what the hormones are. So if it starts out with 100, when you cook it, it's down to 3% wise or 3 number wise. So 97% of it's gone. The fats are where all the problem stuff is stored. So that's where you want the money on the organics. They're expensive. About what? Colloidal silver, I've got some people that just say it's phenomenal. I've read about it. Colloidal silver is excellent for a natural antibiotic. It kills a lot of stuff. Nothing negative on it at all.
Any advantage to far infrared sauna?
Yeah, is far infrared sauna good? From everything I've read about it and looked at it, it looks real good. For detoxification. Sweating is excellent. Skin's a big organ to detoxify. Very good. Apple cider vinegar, it's okay for a salad dressing. I use it. Yeah, I don't know. I mean, you read this stuff. I've seen no science of it. It's not going to hurt you. Don't know. I mean, well, the size is everything. I just don't know exactly what you're doing. I mean, there's companies I've worked with that have really, really good ones. If anybody cares about it, you can send me an email and I'll tell you who I know of that's real good. They specialize in a few things, and that's one of them. Yep. Yeah, is hyperbaric chamber good? Absolutely. But it's expensive. Excuse me. It's expensive. You can buy them at home. But these oils are basically a hyperbaric chamber every day automatically. You won't need it. Now, if you have cancer, it's very, very good. But I'm not talking that. For just daily prophylactic use, these oils are phenomenal. Anybody in hyperbaric therapy for anything should be using the oils. I'm surprised the hyperbaric physicians organizations haven't contacted me ever. It's incredible. They just don't really care. They have to know about me, but they just don't seem to care. Acid reflux, stop the carbs, it'll be gone. Don't need any purple pills, any of that stuff. It's nonsense. I've always known it to be carb activated. Eat a steak and tell me if you get acid reflux from the steak. I've never had anybody say yes. Good question. Ibuprofen, it's a non-inflammatory, it's a NSAID, right? They're all awful. Any of the anti-inflammatories, the steroid's awful. It stops the prostaglandin production, and so does the NSAID ones like ibuprofen. I mean, if you want to use it occasionally, do not use that crap every day. You're going to kill yourself. It stops all the metabolism of the EFAs. It's really, really bad. One stops the whole thing, one comes in from the cell membrane with arachidonic acid. I mean, it's a complicated thing, but it still screws it up. That's all you need to know. Don't want to be doing it. You know, you want a capsule once a week. It's not going to kill you, but anything else. By the way, aspirin you were talking about, it kills the red blood cells for at least 12 days, whatever their life is, maybe 90 days. It ruins them. They're gone. They're defective forever. It's an awful, awful drug. Blood cells go through the capillary. It goes through one cell at a time, if you can believe this. It has to fit through the darn thing. And a capillary is all omega-6. You have 40 billion of them. So if you have adulterated omega-6, that's where the transfer is. That's screwed up too. Not in the cell membrane. This is in addition to that. Goes on and on. It's a bad story. That's a good question. Arthritis, again, with the lack of the oils, you put that in, it typically goes away, way down. Between the oils and the liquid herbal, I used to have an arthritic joint completely gone. Gout, I don't know. I think it's an acid buffering issue, and the oils are acid-based buffers. So I think with gout, you take the oils, you're not going to have gout anymore either. You shouldn't have that stuff. Yeah, good question. Where do triglycerides fit in? All of this is in a lipoprotein, so it's this big thing with cholesterol, triglycerides. They're all in a big thing. Nothing means anything by itself except the parent essential oils. That is the key to everything. If those are the right structure, nothing else matters. And that's what I specialize in this big mess. What's everything? What's nothing? Everything is not equal. Anybody telling you everything in moderation knows nothing. Because that's what I would say if I knew nothing. Because I've minimized my chance of being wrong on anything. So they're not stupid saying that. They just don't know anything. Because everything in moderation is stupid also. A little bit of cyanide in moderation, you're dead. Red wine, resveratrol, it's garbage. They spent $800 million, the drug company, for this resveratrol, or however the heck it's pronounced. It failed. Because they wrote off $800 million. It's bullshit. There's a guy that wrote a book on this, and I said, big neurosurgeon wrote a book, and a major published it. So I had a meeting with him, and I said, it's all interesting, except how many bottles of wine would you have for one of your capsules? And it was at least 100. And I said, isn't that a pharmacologic overdose, that 100 bottles to do this one? You know what his comment was? You raised a very good point. He wrote the damn book and never even thought of that in his own. That's where I start. Are you insane? Alzheimer's, the oils, all tied to microcirculation in the brain. Guaranteed. I haven't done studies with it, but nobody gets Alzheimer's taking these oils. They just don't get it. And I've got a pile of people in their 80s taking these oils. They don't get it, and there's no reason to get it. It's microcirculation. Hypertension in the brain, too. Gone. How good is intravenous chelation? I've heard it's decent. The liquid herbal is chelation on a daily basis. You're better off taking that. That Essiac. Yep. Excellent. It beats the IV chelation. You won't need it. You won't need it.
I've taken capsules that had EDT and
It's decent. It's good. But you're not going to need it with this. Is that strong? Yeah.
if I'm taking,
Too much? I wouldn't take the EDTA. I don't think you need it.
now, as far as the amount of the SDAC, how much you
I do an ounce a day. Ounce a day. But you can take as much as you want. There's no overdose limit. Yeah, I've run the pharmacologicals. You could take 30 ounces a day. Soothing. Question is Crohn's disease, how the oils help. They soothe everything. They're oils. So phenomenally good. Remember, anti-inflammatory is the key to everything. Crohn's is an inflammatory disorder. And don't eat the damn carbs. Minimize the carbs, take the oils, you're going to be in great shape. Outstanding, the oils. Outstanding. Question is migraines. Oils are phenomenal. They're vasodilators. Blood flow. 2 weeks, they should be down by half. Brain-blood barrier, yes. Yeah, the oils are integral in the brain. There's not a lot of the parents in there, but they're highly integral to how it functions. The brain has about 14% DHA, so the brain does need that fish oil stuff, but it doesn't need a lot of it. And it stays there for about 2.5 years. It's got a very, very long half-life, which is incredible. So it better stay good. You don't want to be using up your antioxidants in other places. So you need, has about 10% arachidonic acid, which is an omega-6 derivative. So the arachidonic and the DHA are about the same order of magnitude. But in the brain, it's about 100 to 1, parent omega-6 to parent omega-3. And it's critical. It gets incorporated. This is fundamental, so it does what it needs on its own. It doesn't need our help. It's automatic. Good question. But just that little bit of the right stuff makes all the difference. And also, it's in the capillaries. There's a lot of capillaries in the brain. I think 50. How many in the Iowa study? I think there were about 50 total. And the statistics were big enough. You don't always need 1,000 people. If you get a very big effect in everybody, you need very few people. You only need thousands of people if very few people you see anything, and in the ones you see, you don't get much. That's why you need thousands. But this was a very big effect in 85% of the people. Statistics were superb, all way less than a P of 0.05. It was like 0.001, so statistically accurate off the chart. P-value in statistics means how many times would I have to do the same experiment to get the same result. And typically in drug studies, it's a 95% confidence interval, which means 5% of the time you're accepting that it could be wrong. So if I do something 100 times, 5 times out of that 100, I'm going to have a failure looking as though it's right. So in fish oil, they always go, there's been 15,000 studies. Okay, so if each one had a 95% confidence interval, 5% error rate times 15,000 means 750 studies that failed would appear to be positive. So So the more they do, the more false ones are going to appear true. You don't want something with 15,000 studies. So the probability in ours was 0.001, which means you do the experiment 1,000 times, one time would you get a failure appearing as true. Take it to the bank. It worked. Good question. Excellent question. Reasonable amount of carbs. You have 1 teaspoon in the system. I tell people 12 teaspoons. So 12 times 20 calories is 240 calories, 60 grams. It's not a hell of a lot, and it's so easy to go way over that. You don't need much. The fruit, there is a difference. Only in fruits, it's about a half effectiveness rate. So you could have 50% or double the amount of the fruit because it's a 50% conversion at worst. So fruit gives you the biggest bang for the buck compared to the pizza or the pie. Excellent question. I don't even count the fruit in the smoothies as anything. I don't even count them. I just do whatever you're normally doing and take that. It's so little. It's not going to be much. Banana's just awful. It's a mush. I mean, it's considered a fruit, but it's like 7 teaspoons of sugar. You don't want it. And the blood sugar is going to go high. Same thing with pineapple. Anything else? It's just don't make them daily. I'm not saying you don't want one a week, but don't have it being a daily thing. This one's Cancer is a Metabolic Disease by Thomas Seyfried. It's about $150. Somebody sent it to me. I wasn't going to buy it my own. And the guy really made me mad because he didn't talk about me at all. And he referenced one of my papers. So he knows me. That really irked me. That was the biggest reason I went buy the damn thing. Yeah, I think it's okay. It's like a yogurt, right? Question, kefir. It's okay, but full fat. Now, the Greek yogurt's real good. It's higher protein, less carbs. That's fine too. Cottage cheese is great. The Greek protein, you don't want low fat protein. That'll be high carb. Look at the number of calories in there, and you'll be shocked. Every 20 calories, a teaspoon of sugar. Burn that into your memory. Every 5 grams, a teaspoon of sugar. The oil should help that too. AFib, AF and VF, the parent omega-6, helps it. The fish oil doesn't do anything. That's made up lies. About 5 more minutes, a couple more. Chia seeds are an omega-3, 6, more of the 3 than the 6. It's like flax. Just make sure they're organic. And you don't want to be eating hulls on any of this. You want just the oil. The hulls are called high lignin. They're awful. They're highly estrogenic. You don't want to be eating that. Coumadin's a blood thinner. It's awful. The oils are a natural blood thinner. Yes. You can wean yourself off of Coumadin. It's an awful drug. Cut the warfarin in half. Never stop it. Never just stop a drug cold turkey. Do it in half with the oils and see how he is. I mean, you can tell your doctor. And then get a blood test 90 days out. And it's going to be real good. Don't stop taking the oils. Just stop taking the warfarin. Yep. Cut the medicine back in half as soon as you start the oils, because it's a natural blood thinner. It's not thinning the blood the way you think with the viscosity. It's how they stick together. It's the term they use, but it's misleading. Are you getting hypoglycemia? That's low, but are you typically getting it because you're diabetic and you're going from a high to a low? It doesn't stay low on its own. This insulin generated? She a diabetic? And she's getting low blood sugar? It's extremely rare if you're not diabetic. You're sure she's not diabetic, just not diagnosed? How low is how do you know she's hypo? Passing out, nauseous? Has she ever measured the blood sugar? You're just guessing. How low? Need to know a number. That shouldn't be happening. That's not normal. And typically, low blood sugar is typically the flip side of high. You need to get her checked for diabetes. It's an easy test to do. Yeah, he's the one with his super squid oil. Yeah, I know the name. Sinatra. He should know better. He knows, see, this is the problem. He's right with cholesterol being BS, but then he's selling a marine oil. So he's half right. The other half is killing you. Yeah, Now, in the marine oil, he's putting other stuff to try and counteract it, but it's still the wrong stuff. He knows about my work. They all do. They don't care. Everybody knows my name. I've been around a long time. I'm the biggest anti-fish oil guy in the world. Mercola said this, who's the biggest health internet site in the world. He said that. I mean, they hate my guts because I don't give them an inch, and I'm not wrong. But they just do personal attacks and anything they can do because they can't get me in the science. Question is on the oils and blood thinning. Blood thinning is keeping the platelets from sticking together, not making it like a thin oil, a 5 compared to a 40 viscosity. It's not that. For long driving, though, you can absolutely take more of the oils. Absolutely. If you're on a plane flight or something, you can take 50% more all day long. Anytime you want. You're not getting an overdose. To see if you have an overdose, you'll have excessive bleeding like brushing your teeth, and it's the omega-3 side, not the 6. Or if you smack into something, you'll have a black and blue mark, right? It's called a hematoma if you want to, but it's just a black and blue mark. You shouldn't be having those. That's too much of the 3. If you don't have that, you're doing fine.
Somebody with fibromyalgia or polymyalgia, take the oil out, how soon can you notice something?
First week, you should start seeing a pain difference, and also the Essiac is very, very good for fibromyalgia. I've had superb success with that. 2 more?
You're saying not to overdo on the oils, but you can take off pretty well all the SEAC you want.
Yeah, the liquid herbal you could take a lot, but there's no real reason to do it. Unless you're getting a cold or flu or something coming on, you could take a couple cups of the liquid herbal. It works volumetrically. The oils are incorporated into the cell. That's why it's by body weight, 1 capsule per every 40 pounds. It's actually incorporated in the cell structure. The other works by a different mechanism. I don't like to see you wasting your money. One last one? Okay, go. Good question. Can it break loose with the oils? No. Dissolves it. Does the plaque ever break loose and clog the artery, giving you thrombosis for a heart attack? It's a good question. Say you got plaque and you're taking these oils. Can a chunk come off? Because that's what kills you. No. Dissolves it from the top down. Doesn't go from the bottom out. And that's, again, the PGE1. Things of the nerve, question is sciatica, it could, I can't tell. It depends on how bad it is. But again, the anti-inflammatory effect, it's certainly going to help. I just can't tell how much. So it's a quick test for any condition. You should see a result within 30 days. I mean, it should be that fast. You could take 50% more. You could take double if you want to do a quick test. And you're going to know real fast for whatever ails you. You better get a positive improvement. Now, over time, it typically gets better, but you should see something fast if it's going to work. This stuff is just incredible. in how potent it is. I mean, it's a potency that's a very safe potency. Well, I thank y'all for coming. I'll see you at least next year.